Hello, I'm Dr. Brandon Millick. I'm so glad you've decided to take the time to view this informational seminar. Thinking about bariatric surgery can be scary. It's a big decision, but the more you learn about it, you'll see that the benefits of better health far outweigh any concerns. It's a chance for you to take control of your health and better your life in the process. When you choose Schneck for your bariatric surgery, you're choosing a team of professionals to be with you every step of the way on your journey. Let's talk more about our program. Classifying weight using BMI. So in regards to bariatric surgery, generally we speak of a BMI greater than 40, which classifies you as having morbid obesity. All of these candidates will qualify for bariatric surgery as long as they have bariatric coverage on their insurance. In addition, there's a subset of patients whose BMI is greater than 35 but less than 40, who will also qualify for bariatric surgery too. In order for this to happen, you also have to have comorbidities such as high blood pressure, diabetes, and other items in your health history that would be a qualifying comorbid condition. So if you want to find what your current BMI is, what you're going to do is look at your height and your weight, and then you're going to follow that over on the chart, and that's going to give you a number which means your BMI category. That will tell you what your BMI is, and we'll have a good idea as to whether or not you qualify for bariatric surgery. Obesity has been classified as a chronic disease. There's many factors that play into it: genetics, environmental factors, and personal factors. These types of things will all co-play together and result in overeating or the ability to process nutrients differently. This ultimately results in morbid obesity. One of the benefits of obesity being classified as a disease is that we now have a certain coding qualifications which we can use for insurance approvals in order to get you approved for bariatric surgery. Obesity comorbidities are things such as high blood pressure, asthma, obstructive sleep apnea, heart disease, diabetes, high cholesterol, and there's numerous others. In regards to the risks that obesity poses to individuals, with a BMI of greater than 30, which keep in mind that's not even qualified as morbid obesity, you have a 55% increase in mortality rates, a 70% increase in coronary artery disease, a 75% increase in stroke, and a 400% increase in diabetes. As a matter of fact, males between the ages of 25 and 35 with morbid obesity, remember that's a BMI greater than 40, these males have a 12 times higher chance of mortality than males without obesity. An adult with morbid obesity has a 33% decreased chance of living to the age of 65 than that of a person without obesity. In regards to the bariatric team here at Schneck, there is myself, Dr. Millick. We have Kathy Hildenbrand, who is our nurse practitioner and does a lot of coordinating throughout the program. We have Jill Whitaker, who is one of our registered dietitians, and we have Monica Adams, who is also a registered dietitian. We also have Dr. Aaron Bannister, who is one of our psychologists who does psychiatric evaluations for our bariatric program. So when you choose Schneck for your bariatric experience, you'll have a full team of certified professionals that are here to guide your every step along your journey. In regards to the goals of bariatric surgery here at Schneck, we hope to have a meaningful impact to your life. We hope to increase your lifespan, increase the amount of health that you experience, and make it so that you can do things that you weren't able to do in the past, such as physical activities, hanging out with kids and children and family, and just doing things that make you happy. Keep in mind that bariatric surgery is merely a tool for your success. It's not the end-all be-all of weight loss, but it is an important tool in your journey to having meaningful weight loss and better health. At Schneck, we generally offer 3 types of bariatric surgery. The 2 most common procedures we perform are sleeve gastrectomy and the Roux-en-Y gastric bypass. What I'd like to do now is briefly discuss a couple of their differences and similarities. First of all, the sleeve is one of the most commonly performed procedures that we do. It accounts for about 90 to 95% of all of the operations we perform at Schneck, and it's also about 70% of bariatric procedures performed nationwide. The sleeve procedure, which is normally performed robotically or occasionally laparoscopically, is what we normally do. We go inside the abdomen, we staple off the large portion of the stomach that can expand. This is called the fundus of the stomach. This allows us to recreate the stomach in a much smaller manner, which is responsible for you being able to eat less, and it also helps to control hunger somewhat. The second operation is the Roux-en-Y gastric bypass. Now this is much less commonly performed in comparison to the sleeve gastrectomy. The The Roux-en-Y gastric bypass involves not taking any of the stomach out, but rather we staple across the stomach and create a small pouch. This is then connected to a part of the intestine which is bypassed, which creates a sort of situation where we have both a restriction and a malabsorption component. When you're thinking of the two operations, the similarities are that we create a situation where you're able to eat less. The differences are that with the sleeve gastrectomy, we do actually remove part of the stomach and take that out of your body. Whereas with the Roux-en-Y gastric bypass, the stomach stays inside your body and we staple across it, making a small pouch. So in regards to both operations, what can I hope to achieve? Well, generally speaking, with a Roux-en-Y gastric bypass and a sleeve gastrectomy, you can expect to lose approximately the same amount of weight. Recent studies have shown no significant difference for most patients. So you can expect to lose 50 to 70% of your excess weight with either operation. In addition, either operation has excellent safety profiles. However, the sleeve has been shown to be a little bit more safe than the Roux-en-Y gastric bypass in regards to complication rates. Now keep in mind that both operations are still extremely safe. So when I say that complication rate overall for a sleeve gastrectomy is about 4%, and it's about 6% for Roux-en-Y gastric bypass. These are all complications that we're talking about. So what are the major complications? And major complications are quite rare for either operation. They are only about 1% or less of all operations. Comparatively speaking, the operations are similar to having your gallbladder removed with a 1% complication rate. All the operations are done with 5 to 6 small incisions across your abdomen and all require you to have general anesthesia. However, with the bypass, we will always keep people overnight and will generally send them home the next day. On a sleeve gastrectomy, we will generally send about 70 to 80% or more of patients home the same day. Now, of those patients that don't go home the same day, the remainder generally will go home the following morning, and it's usually because of insurance. Recovery time is about 2 to 3 weeks for each operation. So, as a patient, you might be wondering, why would I choose a sleeve gastrectomy or why would I choose a Roux-en-Y gastric bypass? This is one of the things that I will discuss with you at your appointment. In addition, we'll also discuss SATIs if it's appropriate for you. I can go ahead and tell you up front that for most patients who are relatively healthy and have various comorbidities, we still recommend sleeve gastrectomy as the most common operation. However, there are some situations where I would recommend one of the other operations, but these are a little more complicated and also generally involve comorbid conditions. So in my opinion, the advantage of the sleeve gastrectomy is that it's technically easier and it also has significantly lower complication rates, which result in equivalent weight loss to the Roux-en-Y bypass. So that's why it is my preferred method of bariatric surgery. Now, one of the other operations I've mentioned is the SATIs. This is a single anastomosis duodenal ileal bypass with sleeve gastrectomy. It's a type of weight loss surgery that is a combination of a vertical sleeve gastrectomy and an intestinal bypass. Approximately 3/4 of the small intestine will be bypassed with the SATIs procedure. For individuals who are morbidly obese with a BMI greater than 50, studies have shown that about 84% of patients have successful weight loss outcomes 3 years after their SATIs procedure. SATIs offers patients a revision option also if they've had a prior sleeve gastrectomy and have not achieved the weight loss that they like, or they've hit a plateau in their weight loss and can't lose anymore. In regards to SATIs, we generally consider patients for this operation if their BMI is greater than 50. In that case, we can consider them for an initial operation with the SATIs, or we can also do SATIs as a revisional procedure, as we stated earlier, when patients have had prior sleeve gastrectomy. So if you've had prior sleeve gastrectomy, either at our institution or another institution, and you've had weight regain or have hit a plateau and can't seem to get anywhere through dietary efforts, you can contact us and we can explore whether a SATIs is appropriate for you or not. As we stated earlier, bariatric surgery is a tool in your journey on weight loss. Now, some people have weight regain or hit plateaus after surgery. Now, this is uncommon. Usually a small number of people will have this. It's certainly not the norm. However, if you do have weight regain, once again, we do have options that we can explore with you, and those range from dietary counseling to referrals to your primary care for additional medications, and also the most aggressive option, which would be conversion to a SATIs procedure if you've had a prior sleeve gastrectomy. I briefly want to touch on complications associated with bariatric surgery. There are two different types of complications. There are immediate complications and there's long-term complications. In regards to immediate complications, once again, these are very rare. but they are a possibility. Long-term complications are things such as vitamin and mineral and protein deficiencies, and we address these through aggressive dietary counseling and lifelong multivitamin therapy. Fortunately, these are also uncommon complications. One of the great things about bariatric surgery is that there is a significant resolution in diabetes with all operations. Also, we have resolution of high cholesterol, high blood pressure, sleep apnea, and the operations have a very low 30-day morbidity and mortality rates. So bariatric surgery is extremely safe and an excellent choice in gaining a healthier lifestyle. Special considerations for bariatric surgery are the following. In regards to pregnancy, you have to be 1 year or greater postpartum and avoid pregnancy for approximately 18 months after having this surgery. That's because there will be aggressive dietary shifting and potential vitamin deficiencies which could have negative outcomes on your pregnancy. Another consideration is alcohol. Changes in our anatomy that we construct during bariatric surgery will alter alcohol metabolism. Alcohol is also empty calories, so it can cause you to gain weight. And then, of course, there is always the risk of addiction. We strongly recommend stopping tobacco use as it has been proven to increase complication rates across the board. In addition, we will not operate on people that are consuming tobacco if we are performing a Roux-en-Y gastric bypass due to the significant risks known for marginal ulcer formation at the anastomosis sites. In regards to age, we will generally operate on adults between the ages of 18 and 65 years of age. However, if you're older than 65, we will consider your case on an individual basis based on a record review of your medical records. We do not perform bariatric surgery on patients less than 18 years of age. We also have support groups here at Schneck Bariatrics. Why would you want to attend one of these? You have the chance to ask questions of contemplating surgery, of people who've already had it. It will allow you to create fellowship through a common bond, provides a source of up-to-date information about surgery and the latest developments. We know that people who attend a support group will be more successful with bariatric surgery, and it will help support your lifestyle changes. Will my insurance cover it? This depends on your insurance. Insurance changes frequently, so you need to know your benefits. We recommend calling your insurance company and asking if you have coverage and if there are any special criteria that they need you to meet prior to enrolling in the bariatric program. In addition, when we counsel you at your first meeting, we'll review your insurance benefits as well. In regards to our program policies, with your appointments, your commitment and attendance for pre-surgery appointments sets the tone for your success long term. Your commitment will directly affect your success. In closing, let me congratulate you on taking the first step on your journey to better health. The next step is to contact us for a consultation so we can answer any questions you have. Simply fill out the interest form on the Schneck Bariatrics website and we will contact you to set up a visit. Or you can feel free to give our office a call. I'm so glad you've started on this journey and I can't wait to partner with you for better health. Thanks. I look forward to meeting you.